This is Dr. Dharasha again from WOW IIPRE. You already know what our WOW IIPRE is, right? International Institute of Pelvic Floor Research, Rehab and Education. So as the name suggests, Research, Rehab and Education of Pelvic Floor, we are dealing with the pelvic floor education, for which we are having our workshops, which are having different modules like level 1, level 2 and so on. So in this video, I'm going to explain you a bit about what is the content of level 1, what would be the content of level 2, because we are having many inquiries and I'm sure that this video will help you out in deciding further. So let's take a review of the content which would be delivered in level 1. So level 1 would be a non-invasive pelvic floor rehab practitioner course in which we would be explaining you all the details about the anatomy and the physiology of the pelvic floor as well as the pelvic organs, the relation between the pelvic organ and the pelvic floor, how does they work in synchronicity and what happens if they have some dysfunctions in them. So it would be the basic anatomy physiology followed by the pathological changes which happens in the pelvic floor, either due to the muscles themselves or due to some pathologies of the organs. Then after that we would be describing you different assessment tools which you can use as a non-invasive practitioner. It means without invasion, how can you diagnose what your patient is suffering from? So that is a big boon I feel in the field, because you don't have to invade, though you would come to know that what line of treatment you have to follow. So that would be the assessment techniques which we would be dealing with, in which we will be explaining you different types of MMT grades, HMMT grades, the ring clock assessment, surf assessment, how to use the devices like WOW Vagina Fit, WOW Vagina Dilate, also known as V-Strength VEs, and then followed by how to use the EMG and CV to diagnose, the ultrasonography, how to read that, and followed by that there would be a detailed explanation of the management plan, where you would be coming to know that how to differentiate the management for hypertonus as well as for the hypotonus dysfunctions. So this would be the course content of level 1. And in level 2 would be a practical one, that would be the second and the third day. So the second and the third day in the practical sessions, we would go for all the practical things of what theory you read in the first day. So all the invasive techniques, like how to palpate the perineal area first of all, how to observe the perineal area, post observation how to palpate the external area, after palpating the external area, whether to find whether the patient is having any trigger points or any tender points or taut bands in this area. So after that, the palpation of the orifice, the external palpation of the vaginal orifice, the anal orifice, how to differentiate your diagnosis whether the patient is having urogenital dysfunction or the anorectal dysfunction. Afterwards, how to go for deeper palpation. So first would be the superficial palpation followed by the deeper palpation. So in the deeper palpation, how would you assess or how would you palpate all these different muscles which you are seeing right now, the superficial muscles as well as the deep muscles, how to palpate those, how to find their strength, how to find their relaxation, how to find the trigger points, and similarly for the anorectal triangle. Followed by that, how to check their strength, how to check their endurance, and followed by it would be the detailed treatment plan according to the dysfunction the patient is suffering. What if the patient is having urinary incontinence? What if she has a vaginal wall prolapse? Or what if she is having an organ prolapse? Or what if she is having a fecal incontinence? What if she is suffering from female sexual dysfunctions? Or if she is a patient of hypertonus, say for example vaginismus or dyspareunia, then how would your treatment session would differ? So that will come into the management. So in the management, again there would be separate management and individual management for all these things, which for all these dysfunctions which I just mentioned. We would also explain you how to go for cryotherapy, how to go for transvaginal cryotherapy, how to go for trigger point release, transvaginal trigger point release. There are different trigger point release method like Thiel's massage or Thiel's technique or Weiss-Anderson's protocol or sweet spot protocol. So how to do this protocol, when to do this protocol, specifically how to differentiate that when your patient needs a sweet spot and when would she need a glazers. So how to differentiate these protocols and how to execute them. So all these things would be covered in the second and the third day workshop, in which we would also explain you about the different new technologies which are coming into the market, which can be used for both the types of dysfunctions, and they are non-invasive technologies like WOW PF360 and WOW Women. So, and it won't be just the speaker's delivery, it would be the candidate's practical exposure as well. So you will also get a chance to do all these things by yourself. It won't be like we would deliver and you would listen. It would be like we will deliver, you will practice, we will observe, you will practice, and you will expertise. So I wish that you are satisfied with the course content I have explained in this video. If you have any other further queries, you can contact us on our website www.visionwowgroup.com/ipre, or you can call us on 8141652011. Thank you. Have a nice day. से हो गया